Hi, my name is Russell Pachynski. I'm an associate professor focused on genitourinary malignancies at Washington University in St. Louis. The first study we reviewed was the therapy trial, which looked at lutetium PSMA or cabazitaxel in patients with metastatic castration-resistant prostate cancer. The patients that got lutetium PSMA had an improved PSA response, improved symptoms, and improved progression-free survival. However, there was no significant improvement in overall survival, but the study was important and showed that there is some good responses to lutetium PSMA and improvements in some patient metrics. We then reviewed some of the data from the VISION trial, looking at previous treatments and imaging. Also looked at whether or not patients had PSMA positive lesions in the bone and or the liver, which portended a poor prognosis and outcome. And then looked at the mean SUV of these patients and showed a significant improvement in outcomes, both progression-free survival and overall survival, if the mean SUV off the PSMA PET was greater than 10. So really starting to develop a predictive radiographic biomarker for these patients. We then reviewed the Brockway trial, which is a trial that it's looking at patients with DNA repair pathway defects, and then randomizing these patients to olaparib, abiraterone, or the combination. This is a relatively small trial, but the initial data from that looked good, and the combination of olaparib and abiraterone, at least in the in this relatively small trial, had improved outcomes thus far. The data is still somewhat immature. Lastly, we looked at an anti-B7H3 antibody that was tested in the neoadjuvant setting in patients with localized prostate cancer. Many of these patients had either high risk or very high risk prostate cancer. And initial data from this trial showed that there were several PSA responses, as well as downgrading of the pathology at time of prostatectomy, and a relatively high PSA recurrence-free survival for this patient population. So a small study in the neoadjuvant setting, no control arm, but relatively impressive early data from this agent.